Workplace violence in nursing. Workplace violence consists of physically and psychologically damaging actions that occur in the workplace or while on duty. The first type of workplace violence in nursing is violence with criminal intent. The second would be client-on-worker violence. The third is worker-on-worker violence, and the fourth is interpersonal relationship violence. The most common type of violence to happen in the nursing field is client-on-worker violence.
Some hazards may include infection, accidental needle sticks, psychological trauma, chemical handling, disease exposure, radiation exposure, and some physical dangers having to do with patients may include lifting obese patients, aggressive patients causing harm, and positioning patients. These repetitive motions can put strain on the body and cause harm to the nurse, and all of the other hazards can happen as a result of neglect or negligence or people not doing their job correctly, such as somebody leaving needles out and a nurse coming in later and sticking themselves. The significance of violence in the workplace causes a lot of issues. 13% of days off were a result of workplace violence. Work environments that are full of violence will cause a higher turnover rate, which means less nurses are wanting to work. And a decrease in nurses doesn't necessarily mean that there will be a decrease in patients, and patients still need care. So who's giving it if all the nurses decide to quit their jobs?
Hazards in the workforce can consist of both physical and psychological. A protocol that must be met is hand hygiene. If anything is below 80%, there is something required to be done about it, and it needs to improve. Despite having lots of protocols and advancements, there is programs that still need to be required, and one example is Move Smart training to help prevent injuries from happening with the movement of patients. The increased number of protocols and programs prevent patients from getting hurt and making the workforce a safer place.
There are many important figures when it comes to workplace hazards and violence within nursing. Florence Nightingale was a big contributor to the advancements of hygiene within nursing. In the Crimean War, she noticed that a large number of deaths were caused by unhealthy and hazardous living conditions. To solve this problem, Nightingale purchased clean bedding, soap, towels, and new clothes for the soldiers in the hospital. Nightingale is largely accredited with the high cleanliness and hygiene standards that are attributed to nursing today.
In order to make nursing a safer career, steps can be taken to minimize hazards and injury. The utilization of mechanical lifting devices lowers a nurse's risk of getting injured while lifting patients. Accessibility of proper protective equipment against communicable diseases is also very important. Personal protective equipment lessens the nurse's exposure to contagious diseases, lessening the likelihood that they will contract the diseases they're exposed to. Some hospitals require employees to be immunized to protect them from contracting preventable diseases they will come in contact with. It is important that nurses are educated on procedures and sanitation methods to maintain safety at work.
To prevent and manage violence in nursing, it's important to employ personal safety strategies to reduce risk of violence, recognize verbal and behavioral signs in others that signal stress and the potential for violence, using assessment tools to determine a patient's level of risk for assault, homicide, or self-injury, and to keep a safe environment, which would include making sure there's enough staff on duty, noise levels, workplace security, and the restriction of movement by the public around the facility.